ForTheGoodLuncheon.com.
3-Degree Guarantee, presented by Warren and Griffin, your local 5-star law firm.
Chattanooga's giving spirit is soon to be highlighted in just a few weeks as once again donation dollars come in to help neighbors who otherwise can't afford medical care. And you can be part of that benefit to help when you buy your ticket to the For the Good Luncheon happening on March 6th. Joel Henderson is back with Volunteers in Medicine to tell us more about this very special afternoon. Good to see you.
Good to see you too, and thank you so much.
So I'm so glad to see you. So, you know, I'm not a huge social media person, but I do the Facebook thing. So I saw this pop up, your flyer pop up on Facebook the other day.
Well, then we're doing our job. We're trying to get the word out there. So.
And I thought, oh, look, you don't have to show it necessarily, but I thought, oh, look, I know this person and this person and this person. You're very proud of this team of volunteers you've assembled.
Well, you know, it's in our name, and it really is our driving force, is our volunteers. So some of the social media, also in HealthScope, recognize some of those faces who are really our champions, have really pulled together a first-year event, which we're talking about is For the Good.
So what is it going to be then, Joel? What are we going to experience?
So it's very intentional, and it's because we don't hide behind fundraising. At Volunteers in Medicine, you know, our patients never receive a bill for the care received. So this benefit, which is a luncheon, will clearly benefit Volunteers in Medicine. Our patients are uninsured.
Okay, so there's in town, and I think you don't mind discussing this, there's
Sure.
Volunteers in Medicine and there's Project Access.
They're our cousin.
Okay, but one of you deals with general care, one of you deals with specialized care, correct?
Correct. So we're primary care. So
Primary
so
care.
folks who are needing to see where do you start, you go to see hopefully your primary care physician, and then depending on their diagnosis, many times they might need a specialist. Not all patients, but I call them our cousins because we'll get on the phone and we refer those patients over to receive the other areas they might need beyond our care.
Okay, so you get to choose our topic for a minute.
Okay.
Would you rather talk for a second about the luncheon itself, or do you want to talk for a minute about how Volunteers in Medicine works? Because my question is going to be the type of people who find themselves in your care, because I think that the general public has the wrong idea
Sure.
of what that person looks like.
Well, and thank you for that. So I call it a gap. Many times, and you've been to our clinic, when you walk in, you see our faces. It's folks who are working. Over almost 80% of our patients either have or want to have some type of employment status. So that good working folks, a lot of our patients are also kind of, I hate to say because I'm getting up there too, but I say the older population, but definitely in their 50s and above is the higher population we serve, who have not been to see a primary care doctor in many, many years. And as we talked about earlier, our cousin, by the time they get to us, they have, as our nurse practitioner says, there's a laundry list of areas that we need to kind of tackle to get them on their quality of life and their health.
Okay, it's just curious to me because I've had some conversations at home with my kids about just some topics lately, so my thoughts are going there, okay?
Sure.
A lot of people now work 2 and 3 jobs.
Correct.
But none of those jobs offers health insurance.
Yeah, everything from small business to the hospitality industry, in all due respect. There's just so many employers who just do not provide that.
Or they're not hiring it full time.
Correct.
Correct? So, true, those people could or even may have health insurance from the open marketplace, but then the deductibles to be met are so crazily high. Are they sometimes the people who are finding benefit with you?
Absolutely. And as I call it, if they're uninsured adults and they have that gap, they're going to be one of our patients. We are, by the way, accepting patients right now. So that's, I think, a kind of misdemeanor out there. People are like, "Oh, you're accepting?" And I'm like, "Absolutely." And they're also surprised when I say, "Once you're our patients, when you eligibility, there's no cost." They're like, "It's free," and I'm like, "That's also a wonderful thing, thanks to our community partners."
So, okay, we've kind of had this theme going sometimes about the ounce of prevention that you find this time of year. Helping Volunteers in Medicine is an ounce of prevention for everybody, because if people can have access to the primary care, then you can know what's going on and prevent the future illnesses, right?
Yes, as I say, please come see us today before you are sick. That's the best time to come in, establish a primary care medical home so you don't end up in the emergency department. As many of the patients who do not have insurance would tend to follow into the hospital system.
Okay, so on March 6th, and this is going to sell out quickly, but it's a luncheon. in the afternoon. What are people going to enjoy when they're there, and talk about this lovely gentleman we just saw, Dr. Bowers?
So we're so excited with this first year event to celebrate one, volunteerism, which is in our name, and it was an easy one for our committee. Dr. Robert Bowers, who has been one of our founders, he still sees patients. He saw a patient last week. He'll be the first year, and then moving forward for the Robert E. Bowers Volunteer Service Legacy Award. We're excited about that. We're also going to celebrate a story of a patient, a success story, and so stay tuned for that. And then also, we don't hide behind this because we have to have the funding. We're celebrating a long-term donor, and every year we'll do the same thing as celebrating those three focus areas to continue to grow and glow.
Okay, so here's how you can get your tickets. It's happening, is it at the Chattanooga?
It is at the Chattanooga Marriott. It's lovely if you've not been by, down by the convention center.
At the Marriott, okay, right there on Carter Street.
Yes.
So VIM, that's Volunteers in Medicine -chat.org is how you can get your tickets. Clear your calendar just for the afternoon on March 6th and help people who you may never meet, but your offering will carry them forward in their lives. So thank you so much.
Thank you, Julie.
Feels good to be home. Ashley's President's Day sale is going